Good evening, everybody, and thank you for joining us this evening for a public information meeting about the Republic of Ireland Reimbursement Scheme and the Matter Private Network. My name is Adrienne O'Keefe, and I'm one of the team here at Matter Private, and I'm joined this evening by some colleagues from the hospital, Ms. Orla Smith, who is our patient coordinator, and many of you would already have been in contact with Orla with some inquiries. Mr. James Cashman is one of our orthopedic surgeons. Professor Joseph Butler is a spine surgeon. Dr. Colin Hanratty is one of our cardiologists, and Ms. Orla McCormick is a general surgeon with us. So this is the team who will be joining you online tonight, and we're delighted to have you here. So thank you for joining us. Just to give you a little bit of an introduction, I'll explain a little bit about what the hospital does and who we are, and then I'll hand over to Orla to explain a little bit more about the scheme. So without further ado, let's get started. So for those of you who aren't familiar with Matter Private, we are Ireland's largest and leading private hospital group. We have 8 locations across Ireland, plus a hospital in Liverpool in the UK. So we're in Dublin and Cork with our main hospitals. We have outreach clinics in Navan, Drogheda and Mullingar. We operate an advanced radiotherapy centre in Limerick and also in Liverpool. And we have day hospitals in North and South County Dublin. We're a high-tech hospital, which means we have the expertise to support complex medical conditions, and that includes cardiac, cancer, and orthopedic conditions on site in the hospital. We also have an emergency department, an ICU, and a cardiac care on site. So we can handle both routine and complex surgeries. We have over 300 consultants across a wide range of specialties, so we're not limited to a particular area of focus. We're not just an orthopedic hospital. We do all kinds of different procedures and treatment. So you may come to us for a hip replacement, but at some point in the future, you may need a cataract surgery or a heart surgery, and we can do that for you. We're a JCI accredited hospital, and this is a really important internationally recognized quality standard, which means we're audited very regularly and very rigorously on all aspects of patient safety and quality of care. So you can be sure that when you come to Matter Private, you will be looked after very well. And one of the things that really is important to us is that we have a dedicated patient coordinator for people who are accessing Matter Private through their ROI Reimbursement Scheme. Orla's role is to provide you with all the support and guidance you need throughout your experience with us. So in case you're not sure where we are, I mentioned we have 2 main hospitals in Dublin and in Cork. Our hospital in Dublin is located in Dublin city centre, which is extremely convenient for train, for bus, coming through the motorways. We're about 2 hours from Belfast by train or by car, and there is parking available at public car parks right beside the hospital. In Matter Private Cork, it's a modern hospital located just outside the city centre, fully private rooms, and there is on-site parking. So again, it's very convenient to get to from the north of Ireland, travel by train or by car, it's about 4 hours. And for both hospitals, there is a wealth of hotel accommodation available very close to the hospital, and we have preferential rates agreed with all of those. So that's who we are and where we are. And the first thing you need to do if you're interested in talking to us about the ROI Reimbursement Scheme is contact Orla Smith. So as I mentioned, Orla has been in touch with some of you already if you've been in contact with us by telephone or by email. And Orla is the patient coordinator for the ROI Reimbursement Scheme. Now, her phone number is on screen, also her email address and the website. And Orla will be happy to take your calls, take your emails, and talk to you about any questions you may have over the next weeks or months as you prepare to come onto the scheme. So I'm going to hand over to Orla just to take a little bit of time to go through some of the main questions and answers about the scheme. Everybody else, Colin, Joe, you may turn off your cameras and relax for a little while. And Orla, I'm going to hand over to you. So Orla, will you tell us a little bit about eligibility for the ROI Reimbursement Scheme? Who's eligible and how do they apply?
Yes, thank you, Adrienne. You're very welcome, everyone, to this evening's talk. So I look after any general inquiries that you may have about the scheme. So if you're on a waiting list in Northern Ireland for a procedure, you can apply to the HSCNI for reimbursement. I can assist you with this. There is a formal application and I can help you with completion of this form. It takes 20 working days to get the prior approval. And I do advise patients that you can make your approval before traveling to Dublin for your consultation. So it is quite nice that when you have your approval, your appointments can be fast tracked. It means that you're not waiting, and then we can get you straight into a consultation consultation with a view to the surgery. So we have dedicated slots ready for our patients from Northern Ireland. So once they have their approval, there is no waiting time. And for majority of procedures, you're treated quite quickly. I will help you with all the information that you need. Some patients may need information about the bed nights, may need information about the different procedures and what is involved. And I will provide a price for a comprehensive surgical package as well.
Great, thanks, Orla. Typically, how long do people have to wait for treatment?
Typically, the majority of patients that are traveling to ourselves at the moment, a lot of them are orthopedics. So we are looking, for example, a joint replacement. Initial consultation can be facilitated within kind of about 2 to 3 working days. And then we're looking at surgery within a couple of weeks after that. So it's very quick to get your care. And we don't want patients who have waited a long time to go on and wait again. So we try our best to facilitate speedy appointments. So for that, and then general surgery, we'd be looking at about a week for initial consultation, and keeping with that timeline, a couple of weeks for surgery. It's very quick.
Great. Okay. And should everybody wait to contact you until they've had approval, or should they contact you before they get approval to get the process underway?
No, I'm more than happy. I think you should reach out to me beforehand, because I deal with so many patients. I probably know the answers to the questions that you're not too sure how to answer. So it's best to reach out to me before. I'm more than happy to help. So it probably is easiest to ask myself. I'd hope I'm in the know.
Okay, brilliant. As you said, then typically you get a consultation within 3 to 5 days for orthopedics and cardiology, and other specialties around about 2 weeks.
Yeah, exactly.
Great. Okay. What happens then once somebody's had their consultation?
Okay, so you'll come to Dublin, you'll have your consultation, you'll meet with your surgeon, who will discuss a comprehensive clinical care plan. So I can help you with all the administrative piece before, but it's nice to meet with your surgeon. If you need to have, for example, a joint replacement, x-rays on the day, we'll facilitate that all on one day. And then you'll come down, meet with your surgeon. If you require preoperative assessment with the anaesthetist, this can be arranged. We will also arrange for your COVID swab before you come down for your surgery as well. So everything is arranged from that initial consultation. You meet with the consultant's secretary too, who is your point of contact as well. So if you have any queries, you can either come to myself or the private secretary. So there's a lot of support that you can ring. Sometimes I do advise patients to have a list of your questions before you meet your surgeon. Because you wait so long for this appointment, it's nice to know the questions that you want to ask and have them listed out. But of course, if you leave and you feel you've left something out, myself and the secretary I regularly speak to the consultants. We can pass that on to them. So we would give you a comprehensive clinical plan at that consultation.
Great. Okay. And then after that, all right, let me just move this on a tiny bit. Second. So after the procedure, then what happens, Orla?
So you come in for your planned procedure, and then you're discharged. Once you're clinically fit to do so, you're discharged from the hospital. And then we plan a 6-week post-op appointment, whereby you come back, you meet with your surgeon. For patients, for example, that may have had any kind of prosthesis. So for a joint replacement, you'd have a prosthetic knee or hip. Also with spinal surgery, we might do a post-op x-ray to make sure everything's in place and looking right. That again is facilitated on the day of the 6-week appointment. You don't have to travel up and down. We'll do all that in the one day, which is nice. I appreciate if you're traveling. And then the surgeon will review that, show you the images in the clinic, and answer any post-operative questions you may have. But yeah, it's quite a robust setup that we have. It's very streamlined. We treat many patients from Northern Ireland, so it works quite well. Okay, great. And in terms of the post-op care plan, that's communicated in writing to the GP afterwards, isn't it? So yeah, and then
your local GP has everything you need to continue your follow-up afterwards. Yeah,
your surgeon will then dictate to your GP. So your local doctor will be informed of everything that happened while you were in having your surgery, and then your 6-week sign-off, basically to say that you're fine and you're doing well.
Great. Okay. What else do we need to kind of share with people? This is a typical patient journey. So somebody who might be having a joint replacement with us. So do you want to just explain a little bit how that looks for patients from start to finish?
Yeah, of course. So this is just an example of what a patient might expect when coming to the Matter Private. So we have an initial appointment with the consultant, which I can arrange for patients in that timeline. It's quite quick, within 2 to 4 days. They'll come down, then they'll also meet with, we also have musculoskeletal nursing as well. So we have specialist trained nursing and physiotherapists too, who will give you advice on coming in about your surgery, about the post-operative care. So you're well educated on what to expect and the different exercises you should be doing at home post-operatively. So we do try to educate our patients before the surgery coming down. Then the ward will check in as well with the patients post-operatively too, as well as your consultant. We can arrange for you to speak to one of the clinical team if you ring up and you have a query. Sometimes patients might ring me and say, oh, I'm just wondering about one of the exercise I was given, and I can pass you on to one of the specialist physios and they can discuss anything you might need to know. So we do say 6 weeks after surgery, but I'm always contactable if you have that little question that you think, I never asked that, I should have asked it. So we do offer a comprehensive service that you can be put in touch with the correct clinical team in that timeline as well. And then after your 6-week consultation review, you're discharged off to your GP.
Brilliant. Okay. Hopefully that helps people get a sense of what the picture might look like or the journey might look like with us. Yeah. Orla, I think that's everything we need to go through with you for the moment. So what I might do now is just ask Professor Butler to join us on screen, and he will just take us through a little bit about what he does in spine surgery.
Hello, my name is Joe Butler. I'm a spine surgeon here at the Matter Private in Dublin. I suppose the type of conditions I treat would be low back pain, patients with leg pain, patients with neck pain, and patients with arm pain. My area of interest really is doing minimally invasive spine surgery, so doing surgery through smaller incisions and use of robotics. So use of robots to really accurately place our screws and do our surgery in a more precise fashion. The image here just shows some of the robots that are out there on the market. The one in the center there, the Excelsius GPS, is the robot we've been using here at the Matter Private for about 3 years. So we've done over 100 cases with this robot, and it allows us to do much safer surgery, much smaller incisions, and get patients moving a lot quicker. The next slide will show us a little bit about the workflow and the robot that we use. So as I said, this is the Excelsius GPS. When the patients are having spine surgery with us, they come into the operating theatre and we do some x-rays and we produce what's essentially a CT scan. The images get sent to this robot and the robotic arm, and allows us to place screws really accurately in the low back, in the upper back, or in the neck. And basically this allows us to do much smaller incisions, much smaller surgery, and allows us to take on, I suppose, the more challenging cases in a much safer way. The robot is quite slick and small, and it's easy for us to store it, and the program is going quite well at the moment. So moving on to the next slide there, Adrian. So a typical case we would have is a patient with a really worn disc. So you can see the picture here, it's x-rays and an MRI scan, and you can see maybe the blocks there on the x-ray, they're the vertebra, and in between the vertebra are what we call the discs, and the intervertebral discs basically are your shock absorbers. The last level there shows a very worn degenerative disc. And what happens is these patients present with a lot of back pain, a lot of leg pain. And this gentleman here was a 65-year-old gentleman with low back pain and leg pain for over a year. And this type of patient is really suitable to have a minimally invasive fusion. So we'll go on to the next slide. So this is kind of the setup we have in the operating theatre. So a patient is lying on their tummy, and we use imaging to place the screws, and the robot to place the screws really, really accurately. Patients essentially have something like a 2 to 3 centimeter incision, the lower part of their back on both sides. It really prevents us from having any blood loss, really minimizes risk and complications associated with the surgery. And the surgery we're doing now is a lot faster. These patients are having surgery in an hour and a half to 2 hours. These patients are getting up and they're moving on day one. And traditionally, spinal fusions stay in the hospital for about 5 days. These patients are going home on day 2. So it really is a huge benefit to the patients. So going on to the next slide there. So this is another typical case. So we have a lot of patients presenting with cancer and cancer that's spread to the spine. You can see the image here shows those little blocks, those vertebrae, and the one in the middle is very collapsed, looks very, very different to the others. This patient has a fracture in their vertebra from cancer spread to the spine. This patient was sent over to us and had 4 weeks of being bedbound. Patient wasn't able to walk, wasn't able to mobilize for over 4 weeks. This patient had also radiotherapy, so we treat through radiation the spinal disease. So we'll move on to the next slide. So this type of surgery, this type of patient is really amenable to having a minimally invasive surgery. So she had 4 1-centimeter incisions, allowing us to place the rods and screws really, really precisely and really accurately. No blood loss, no surgical risk. Patient it takes about 50 minutes to do this surgery. And moving on to the next slide. This patient mobilizes for the first time in 4 weeks on day 1. On day 2, this lady was transferred back to her other hospital and was mobilizing for the first time in 4 weeks. This is significant quality of life type surgery for this patient. This is just a small video showing some of the technologies that's coming on stream that we're looking to adopt in the next year. So this is what we call augmented reality. It's very fancy cameras and very fancy computers that allow us basically to see all of the bony anatomy, all of the spine with an image overlaying the patient's skin. This is going to come on stream in the next year for us, and this is going to be a real game changer. We're going to be able to do surgery even safer, even more accurately, allowing us to really provide a very high standard of care. It's going to help us do the smaller surgery safer, but also the much bigger, more complex cases much safer. So that's really it, guys. We can go through some questions in a little while.
Thanks for that, Professor Butler. That was really interesting and great to see the technology is helping to get better outcomes for patients. So really, really interesting to see what's coming down the line. Thanks for that. And what I'd like to do now is invite Mr. James Cashman to join us on screen to tell us a little bit about orthopedic surgery.
Oh, hi, can you see me there? There we are. Great. I've had some technological difficulties on my end, so I'm on my iPhone. I'm going to record a TikTok video for you, I think, instead of a Zoom webinar. So I'm James Cashman. I'm an orthopedic surgeon working in the Mater Private in Dublin, and my specialist interest is joint replacement, typically hip and knee replacement, both first time around primary joint replacement and revision joint replacement. So the majority of the patients that I treat in the Mater Private Dublin are hip and knee replacement patients, and I have a particular interest in enhanced recovery or early return to function. I also have a second interest in young adult hip, so I look after younger patients who have problems with their hips. So the process has been outlined by Orla and Adrian there, but essentially once we see a referral, we aim to get you down as soon as possible to assess your hip or knee and ensure that you're suitable for that surgery. Specifically in relation to joint replacement, all patients are seen in the pre-assessment clinic to ensure that they're fit enough to the surgery and for the type of anesthesia that we're going to do. It's typically performed under spinal anesthesia, which means an injection in your back and you're numbed from the waist down. So you also get some sedation. You typically don't remember anything in relation to the surgery itself. But the spinal anesthesia facilitates early walking, and the majority of my patients are walking about an hour after their surgery. And the average length of stay for those patients is typically 1 night. So most people are fit to go home the next day. I have a cohort of patients also that are fit to go home the day of surgery. Now, saying that, to get out of the hospital, you have to meet your discharge goals, which is walking independently and pain well controlled. And if that requires a week or 2 weeks, that's fine. But typically we aim to get people up and going pretty quickly. Most people are discharged from the hospitals on 2 sticks or crutches, which they gradually wean off in a program given to you by our physiotherapists on discharge. Typically wean off the sticks or crutches over about 6 weeks. I would typically review you at about the 6-week mark to ensure that everything is going well. In relation to the post-operative care, I would usually refer you to your GP to have a look at the wound. my patients don't have any stitches to be removed as such, but it's always a good idea to check in with your GP after any surgery at about the 2-week mark. We have an excellent safety net for our patients who undergo surgery at the Mater Private in Dublin, which includes our specialist nursing staff up on the ward. We have dedicated orthopedic physiotherapy. We also have a nurse and a doctor who work specifically with the joint replacement team. So we have multiple points of contact to look after you even when you've been discharged home. After the 6-week mark, then most people are fit to be discharged back to their GP. Some people require physiotherapy, but that can typically be organized at home. So joint replacements are really a great operation, and I appreciate that a lot of patients up in the north are struggling with long waiting lists, and this is something that we're able to do safely, quickly, and get you back up on your feet as soon as possible. So if you have any questions in relation to it, I'd be delighted to answer the questions here tonight, or alternatively, you can contact me at james.cashman@matterprivate.ie, or I'm happy to take any queries through Orla as well.
That's super, Mr. Cashman. Thank you very much for joining us there for now. We'll bring you back on screen when we have some questions. So what I'd like to do now is invite Dr. Colm Hanratty to join us on screen. So, Colm, if you're ready.
Hello, can you see me okay?
Yeah, we can see you fine, I think.
Okay, so my name is Colm Hanratty. I'm a consultant cardiologist. I trained in Belfast and worked in Belfast for 17 years up until April 2020 when I moved to the Mater Private in Dublin. My area of expertise is in coronary intervention, where people with angina, exertional angina, have stents put in to relieve angina and relieve blockages within the coronary circulation. And in particular, I specialize in more complex ends, so people that may have had previous cardiac surgery, bypass surgery, and have issues with blocked arteries. I specialize in that. Most of the procedures we do are done minimally invasively through the wrist. We put a catheter up to the heart, take pictures of the coronary arteries, and then put in a stent. Most of these procedures are performed, as I say, minimally invasively. Patients go home usually the next morning, though some of them could go home today. But for logistical reasons, if you're coming from the north, you probably would be staying overnight. Within the cardiology area, I would be a plumber, but we also have electricians who specialize in what we call arrhythmias, which are an irregularity of the heartbeat, atrial fibrillation being the most common. The cardiology unit is the largest in the Republic of Ireland, both private and public, in terms of the processing of these type of procedures. And we've got great expertise in people who have arrhythmias, paroxysmal atrial fibrillation being the main one. And again, we've got the expertise where these can be done minimally invasively, and patients are generally discharged home the next day. We also then have got expertise in what we call the structural side of cardiology, where patients that have valvular abnormalities, a lot of the valve problems can now be dealt with minimally invasively through the leg. So aortic stenosis and mitral problems can be dealt with very effectively through the leg, especially in patients who are not fit for cardiac surgery. It's worth mentioning cardiac surgery, and if you're on a waiting list for open cardiac surgery, actually the surgeons in Belfast are bringing a lot of the NHS patients down to Dublin currently in a waiting list initiative. So we have a track record of dealing with patients from the north. I have great links still with my colleagues in Belfast. So in terms of ongoing input for anybody that does come down to Dublin to get treated, at the very least, we'll be communicating with your referring cardiologist. That would be a direct phone call if required, because we know them all very well. And certainly if there's any issues with ongoing input or ongoing queries, we have a good relationship with our colleagues, so there'll be no issue with that. So if you're on a waiting list for a cardiac procedure, if you want to come even for a second opinion, explore the options and discuss the treatment options, please feel free to get in contact. Thank you.
That's very great. That's great. Thank you very much, Dr. Hanratty, and thank you again for giving us that outline of what you can do. I'd like to hand over now to Ms. Orla McCormack. Orla, if you could just take us through a little bit about what you do. And I'll put your slides on screen if you can just give me one moment. Okay.
Sorry, I think there's an issue with my camera, but can you hear me?
We can, off you go. Yeah.
So my name is Orla McCormack. I'm an upper gastrointestinal and general surgeon. And I operate on the esophagus, the stomach, and the duodenum, but also I do a lot of general surgery. So I do a lot of gallbladder surgery and hernia surgery. And I trained in Ireland, but I did a fellowship in Australia and worked in Australia for a while. And then I became a consultant in the UK. So I worked in the NHS in Edinburgh and did a lot of gallbladder surgery and very large hernias actually in Edinburgh in the Royal Infirmary there. And then I moved to London and I worked in the Morrison and did a lot of cancer surgery. So I've been through the NHS system and I'm kind of aware of the patients in that system. Next slide, please. So far I've seen a number of patients from Northern Ireland, and the patients who have been referred to me are patients with gallstones who are awaiting laparoscopic cholecystectomy, which is removal of the gallbladder by keyhole surgery, patients with groin hernias. The majority of those, I would do by keyhole surgery. And then some patients with very large abdominal hernias who are on waiting lists for a long time. And these patients often require open surgery to fix these, and they can be a bit more challenging and a bit more complex. But I suppose because we work in the matter private, we're able to accommodate kind of all types of patients who are on waiting lists for general surgery. And we have the backup here to manage all of that. So what I normally do, I haven't gone through the specific operations in this presentation, but just to kind of explain the process, I usually meet with all the patients in my rooms preoperatively. I take a history, do an examination, go through all the relevant documentation that they have. So that's usually previous investigations that they've had done and letters from their surgeons and the reason why they're on the waiting list. And very often patients don't need any further investigations, and I can go ahead and plan the surgery. But in some cases, because people have been waiting so long and sometimes they have other comorbidities, they will need to have further investigations prior to the surgery. And sometimes that's an up-to-date CT scan, or sometimes the patients do require an anesthetic review. So then I would discuss the surgical options and what the actual surgery involves, and then the potential complications and the standard kind of post-operative course and expectations of the patient. Next slide, please. So just in general, the majority of gallbladder and hernia surgery that's laparoscopic or keyhole, those patients usually stay overnight because they're coming back down from the north. But they usually only have to stay one night and are able to be discharged the next day. Obviously, for bigger surgeries, the patients have to stay for longer, but I would discuss all that at the time. Most people who have keyhole surgery are off work for 1 to 2 weeks. They can't do any heavy lifting or straining for 4 weeks and no driving for 1 week. But we give the patients all these instructions when we see them. I suppose the other kind of good thing about the matter private, if there's any complications or any issues post-operatively, we can see the people back or readmit them. And because it's a big hospital with every available resource, we can treat the complication here. So the patients don't need to be referred to other units if there are any issues. And then as regards follow-up, I often don't see people back for a follow-up consultation if it's not needed. So if they're well, they don't need to come down. I usually do a follow-up phone call. But if required, if I need to review a wound or that, I'll see them back. And then all the correspondence and all the results of their histology is sent on to the GP. So that's all I have in my presentation, and I'm happy to take any questions later on. Thanks.
Thanks, Ms. McCormack. That was great. And I'll just invite our final speaker to join us for this evening. So Professor Conor Shields is going to join us now. If you could put on your camera, Professor Shields.
Guys, thank you for asking me here.
Great to see you. Thank you.
My name is Conor Shields. I'm a professor of surgery in the Mater at private hospitals. I've been here for about 15 years. I trained in Ireland and in France, and my practice would be quite similar to Orla McCormack's practice, who's just spoken, but with a further focus on the lower end of the bowel and anal problems. So I would also do gallbladder surgery, hernias, both inguinal and incisional and umbilical hernias, and also a lot of hemorrhoid operations, both small jobs and then more extensive work as well, fissures and fistulas. Like Orla, I've also seen quite a number of patients from Northern Ireland so far, and the process tends to be that we'd meet in the clinic. The procedure would be explained, and then the patient would get a date and time there and then for their procedure, which tends to be come around relatively quickly. After the patient goes home, they are very welcome to return for a post-operative visit in person. Although if they're feeling very well and if they feel their problem is resolved, I would be perfectly happy to facilitate a phone call or a telemedicine consult if someone wanted to spare themselves the journey. As Orla mentioned, we are a fully equipped and fully featured hospital, so regardless of the complexity of your problem or the clinical course which it takes, we would be confident that we can address or provide everything that is required. And if you were to require further care closer to home, we do have contacts within Northern Ireland, so we could arrange that as well. And that's really all I have to say.
That's great. Thank you very much, Professor Shields, and appreciate you joining us this evening. Orla Smith, if I could invite you just to join us back on screen now. We have a couple more questions we'd like to go through, and I'd just like to remind everybody this evening that you can submit questions to us live through the Q&A box. It's there on your screen, hopefully, and we have a number of questions coming in already, but we'll get to some of the ones that we anticipated in advance, and we might just go through some of those first of all. So Orla, two questions that come up all the time, and I think you can very quickly answer these as, what's the cost to be treated Mater Private and how do I pay for my treatment? So what can you say about that?
Okay, so I'll just start with the payment. Is made 7 days in advance of the procedure. So the patient can do it many ways, like you can do it through even an online portal where you simply can just go online. It's a very simple link and you can make your payment. You'd be given your medical record number. So this links your payment to your name. So we cleared with ourselves. Alternatively, we can do it over the phone, or you can go to your local bank and do a bank transfer. So there's a couple of options. Some patients, obviously, if you're going for the likes of major spinal surgery or a large procedure, prefer to speak to someone on the phone and just to have that reassurance. It's cleared, I know it's gone. So we do offer that one-to-one. If you'd like to speak to someone, you can do that as well. With regards to the surgical packages, so we offer bespoke packages for each procedure. So for something like, say, joint replacement, as it's very straightforward, it's usually just one kind of package that you'd be looking at. We offer a package of care. It's €12,650, which includes pre-op consultations, x-rays, post-op consultations, post-op x-rays, all your inpatient stay. The reason why Mater Private is a bit different to other hospitals is we actually offer a 28-night post-op guarantee. What that means is you're covered for whatever you need for 28 nights post-op. Now, we do anticipate you're going home kind of 3 or 4 nights afterwards. However, it's very reassuring. I know for myself that if I was going somewhere, I'm just focusing on getting better and getting the care that I need. I'm not worrying about finances. I'm not worrying about anything else. So the safety of our patients is number one. So that was quite important when we looked at packages of care, to know you're just focusing on getting better. Even if you were to go home and then say, oh, I don't feel great, I kind of would have a bit more security if I got this looked at. You just ring me, you can come back down. If you need readmission for whatever reason, if you need a second procedure, you're actually fully covered for that. So it's a very comprehensive package of care. With regards to other procedures, such as maybe like spinal fusion, they can vary because they're not as simple as kind of a hip or a knee. So there is different packages of care, but I can offer them that pricing, like any pricing for any procedure. If most of it, I have it ready to go straight away, but if it's something that I don't have, I can offer to you within 24 hours. It's quite quick to get you a price for a procedure. Sometimes I might say, you might give me a clinical letter, and then I might show it to, say, Prof. Butler, and say, what do you think this is going to be? So I would go to a surgeon and show them, and they have a good idea on what the patient might need. And then when you come for your consultation, it's confirmed. General surgery, similar as well. Like majority of patients that I've seen are hernias, gallbladders, and that type thing. So we've all that pricing readily available that we can offer. So yeah, just reach out to me. It's no problem at all.
Great. Thanks for that, Orla. We have questions coming in about follow-up care.
Yeah.
So maybe you might just explain a little bit more about that.
Yeah, of course. So the follow-up care, the standard plan is your 6-week follow-up, and that's where we would aim to get the patient that they're home and they're getting back on their feet and they're just taking it easy and having a healthy recovery. But again, that follow-up care, the 28-day, you're fully covered, and it's quite comprehensive. And then for ongoing, the only time I have personally seen patients that have come back past that is if they need a second procedure. So sometimes you might get one knee done and then they'll come back to me a couple of months later and go, actually, it's my other knee now. So sometimes we do have return patients that come back down to us for a second procedure. So, but I'm always contactable, and all the consultants have private secretaries who you can contact directly as well. So, it's no problem. If you have any queries, you just come back to us.
Great. Thanks, Orla. Now, I know COVID is still on everybody's mind, so questions that are coming in, and also we'd expect these.
Yeah.
Do people need to self-isolate before surgery, and can they get their pre-surgery COVID test done locally in Northern Ireland?
Yeah, so our infection control policy is that you have to have a COVID swab before coming into main theatre, and that would be the guideline. So you don't actually have to isolate, but we would require a PCR to make sure it's negative coming into the hospital. This needs to be within 48 hours of your procedure. Now, we can obviously offer that. It's covered in your package of care. There is no charge for that. And if you wish to have it done locally, that's fine as well. We just need it from an accredited lab, and that report has to be printed within 48 hours. So that would be the infection control guidelines.
Great. Okay, hope that's clear now for everybody.
Yeah.
We have lots of questions coming in, so thank you to everybody who is doing that. If we have time, we'll try to get as many questions as we can, but if we don't have enough time this evening, we will take them offline and reply to you after the meeting tonight. So don't worry, if we don't get a chance to answer your question, we will get back to you directly. I'll start off by inviting all of our consultants to join us back on screen, because we have questions for quite a few of you already coming in. So we might just start with actually one about you, or you might be able to handle this one. In fact, we have somebody asking about ENT surgery. Is that something we can do?
Yeah, we are a full service high-tech hospital, so majority of things that patients are looking to have done, we can facilitate. Like we actually offer pediatric ENT as well. So we have quite a robust service when it comes to ENT. I think we have 5 surgeons that are based in the Mater Private. So if a patient does need any kind of procedure, I find with ENT, sometimes I do require a letter. Patient might say, oh, I have an issue with my nose. And I kind of have to say, okay, we need a bit more information there. So if it is something that's, unless they can state it's a named procedure, then I'm more than happy to show a surgeon, but yeah, we definitely can.
Great, okay. Mr. Cashman, a question for you to kick things off then as well. We have a question from a patient who has osteoarthritis in both knees, and they also had high tibial osteotomy a number of years ago. So they've been approved for a partial knee replacement on their left leg, but now thinking they might need a bilateral surgery. Is that something we can do?
So yeah, so the way this issue would typically be approached is I'd assess the patient to see exactly what they need. And if the situation has changed since they were initially seen on their outpatient appointment in the north, then maybe what they need is different as well. So the patient can be assessed to see what exactly are their requirements, and it may well be that where a partial knee was initially indicated, maybe it's a total knee at this stage. But yes, this can all be done. Patients will be assessed, and unilaterals and bilaterals are both possible.
Great. Okay. And another question for you then, for somebody who has had a hip replacement done previously and is now looking at that again. They're concerned about the recovery time, and if they're driving back to Coleraine or somewhere, relatively far away, they have a concern about spending that much time in the car. Would you have any guidance about that?
Yeah, so we treat people from all over Ireland and in MPH Dublin, from West Donegal, West Kerry, and people who have long drives home the whole time. And it's never going to be a situation that you're going to be kicked out of hospital. It's a case of when you're fit to go home, you'll go home, and that may be after a short duration, or it may require a little extra time. When there's ever a longer car journey required, the general advice would be plan to break that up and stretch your legs maybe halfway, or it depends how far you're going. But I wouldn't have any concerns about looking after that kind of problem.
Okay. Professor Butler, a question for you, if we can. Somebody who is interested in spinal fusion surgery has heard that he can't bend or lift or twist until after the fuse is taken. How do you know that when that's happened, and how do you prevent those movements? Is a back brace used? And also, how do they access physiotherapy during their kind of recovery period?
Yeah, so spinal fusion surgery, as I said, usually we're doing it minimally invasive now and robotically. The patients are usually going home on day 2. My advice really for the patients is, for the first 6 weeks following surgery, you're really just walking and getting some gentle exercise. No heavy lifting. I don't want to see patients doing any kind of forceful physical activities. When you're picking things up, you're bending your knees, you're bending your hips, you're being sensible about that. Sure, when you have a fusion surgery, it does make you a little bit stiffer in the lower back. Most patients we're doing are usually a single level, so it doesn't dramatically change the low back in terms of stiffness. Patients typically for the first 6 weeks, as I suggest, are just walking and do a bit of exercise. When you come back and see us at the 6-week check, we take some x-rays and make sure everything looks good. And that's the point where we get you to see our physiotherapist on the same day. And we give you much more kind of advanced exercises at that point, where you really start working on your belly and your back and getting kind of good habits in place for the coming weeks and months following that. And really between the 6 weeks to 12 weeks, you really push on. And that's the point where we push patients forward.
Great. Okay. Thanks for that. Dr. Hanratty, a question for you. So we have a patient who has AFib, having had stents a number of years ago, but they're not on the list for treatment currently. Now, they've written to their cardiac department to try and get on the list for treatment, but they haven't heard back yet. If they were on the list, they go private. So can we offer them any advice about what they should do?
Yeah, I suppose, well, the question would be to yourselves actually in terms of informing us and across the board. So the same would apply to somebody who's got a sore hip. They know they're going to need their hip fixed, but they're not actually on a waiting list or with any of the conditions. So maybe you could inform us, are you able to come to Dublin to get a second opinion advising a procedure and then proceed from there? Is that something that is available with this scheme, or do you have to be on a waiting list in Northern Ireland before you can seek the scheme?
So Orla, I think you can probably speak to that. As far as I'm aware, you do need to be approved and on a waiting list in Northern Ireland, but you may benefit from a second opinion from somewhere like ourselves.
Yes, of course. So you need to get yourself onto the waiting list. There is ways of doing that. Obviously, you can speak to your GP and get a referral sent in and get yourself boarded. But with regards to if you did want to come down and meet one of our cardiologists, of course, that timeline again is kind of 2 days, and that's what you're looking at. But certainly speak to your GP. That's what I'd advise. I definitely will be engaging with your GP there. If you're waiting and you're struggling, like they can support you with that application as well to get that information into the HSC and get you listed.
So in terms of advice for the patient who's asking, my wife's a GP in Belfast, the system up north, unfortunately, is still quite struggling for a variety of reasons. And so I think getting to see a consultant in a hospital to get onto a list is going to be a real struggle for you. I think that one thing you could do is come and get a second opinion in Dublin, and that may well help in terms of influencing or getting you onto a waiting list. So you've already seen a consultant cardiologist, and your GP can send that to the cardiac unit wherever you are, and that should then help in terms of if we're recommending a treatment option. I think it's unlikely that somebody else is going to contradict that. So the second opinion, I think, is worth getting that anyway. But certainly that's where I would go.
Great, thanks for that, Orla and Dr. Hanratty. I hope that's helpful. Mr. Cashman, we have a question here about steroid injections and how long should the interval be between a steroid injection to the knee and the performance of surgery? And also what happens if there's a complication, such as an infection of the implant?
Sure. So the wait time is 3 months. You should not have a joint replacement surgery within 3 months of a steroid injection due to an increased risk of infection. If there is an acute infection in the postoperative period, we deal with it. That's the end of that conversation. If it's a longer term thing, if it occurs a year or 2 or 3 years later, then it would probably be dealt with locally up in Northern Ireland. But certainly in the early postoperative period, it's no problem. We deal with it in Dublin.
Okay. And we have a similar question, actually, I think, which is addressing the same issue about if metalwork needs to be removed or a joint needed to wash out after the 28 days. Is that included in the package? So I don't think so with the answer. But we might
so in terms of dealing with complications after joint replacement, it is covered. We deal with everything in the early postoperative period, no problem at all.
Okay. For Orla, but indeed for the rest of the team, are there any delays due to surgery at the moment due to COVID-19? How are we finding things?
Look, we're a fully private hospital, so also we're an elective hospital, so our procedures are planned and patients are obviously swabbed before they come in, so the lists are well managed, and we don't necessarily take in patients, say for the acute care of COVID or anything like that. So it is well managed that it is an elective hospital. So we seem to be managing them quite well. We're adhering to the timelines that we mentioned earlier on. So no, we seem to be getting on quite well. We're not faced with the challenges of the public hospitals, both North and South have at the moment, so we seem to be getting through the list fairly okay.
Okay, and just as a reminder, Orla, would you just recap on the average waiting time for surgery? We've got a couple of questions coming in about that. They might have missed it earlier.
Yeah, of course, no problem. So it depends on the surgery, but usually, like you're looking at weeks. Like we're quite quick at getting patients in, and the only time I have seen recently a patient that had a slightly longer wait was they came in for routine joint replacement and they had history of an aortic valve replacement. So we did require, and there was nothing on the referral. So to be safe, the anaesthetist at the pre-assessment wanted to get a bit more information about that valve, make sure everything was safe. The patient was on warfarin. There was a few kind of questions that we just needed to clear up preoperatively. So I assisted the patient with getting the notes from the cardiac team in Northern Ireland, got them to the pre-assessment team, and the patient has had their joint replacement last week. So I'll help you. If there is any delays, you just come to me. I can push it through and assist you. If there's more clinical information needed or anything from the hospital's perspective, I can help with that too.
Okay. And Orla, can you give people an overview or an outline of how much they would typically get reimbursed and how long does reimbursement generally take in your experience?
Okay, so the HSCNI disclose that to the patient directly, so they will give you an amount that you can claim back. So make your application prior to coming to Dublin. This is why I do say to patients, like I do appreciate if you're coming up with a certain amount of money, you'll want to know what I'm paying, what I'm getting back, is it within my means, so it's nice to have the opportunity to make that decision. The reimbursement letter from the HSCNI takes 20 working days to be sent out to the patient. So you'd be looking at kind of at the moment, I think they're at the max now. They're not really sooner because they seem to be extremely busy from what we see. I keep using joint replacement because that's what's so common, but patients commonly tell me for a joint replacement they will pay matter private, so it's approximately about 10,500 in sterling, and then they can claim back about £7,000 from the HSCNI post-op. So like it is fairly immediate treatment, and the patient will be paying in around kind of £3,500 themselves.
Okay. And Orla, we have a number of patients who obviously heard on, I think it was UTV yesterday, that The scheme is due to expire at the end of June. It was just a 12-month scheme that was set up as a temporary measure after Brexit. So I suppose people are wondering, is it possible to have procedures done if the process has already been started before the end of June?
Yes, of course, like obviously that's a bit unsettling that it's coming towards a cutoff point that we don't have any further information, and this is why we're trying to support patients with their applications as best we can to get them in before that date. But the reassuring piece is if you can get your application in before the 30th of June, that is valid for 9 months. So it means that maybe you do need to have a procedure done, get your information in, get your approval, and then you might say, I'd actually like to come down in September. So the patient has that security of a bit of time, bit of planning, and so you have 9 months that approval lasts for.
Okay, so again, more questions about this. If the scheme closes in June, surgery doesn't have to be completed before that date. They have 9 months once they've received approval for the surgery to be completed. Okay, let's just have a quick look and see if there are more questions coming in. So if the surgery turns out to be bigger than anticipated, does the cost increase significantly?
Okay, so where we might see something like this is if a patient is on a waiting list for a spinal decompression, but they may be on that waiting list for 3 or 4 years. So by the time they actually get to see a surgeon, they clinically need something that's maybe a fusion, and when they come to see the consultant, it ends up being a larger procedure. So what I had a patient recently that happened to, and they actually went back to the HSCNI with the clinical letter from the consultant here in Mater Private, and they allowed them to make a further application and get approval for further funding. So if your procedure changes to something else, you can go back to the HSCNI with your new clinical letter stating the reasons why you need to have a different procedure done and get approved for further funding.
Okay, great. Orla, I know you've talked a little bit about pricing and how essentially people should contact you if they want a price list. We don't have a standard price list because every procedure is quite unique and bespoke. So really, if people want to get a price for a particular procedure, they should contact you by email or by phone and you'll take it from there. Is that right?
Yeah, of course. I have a comprehensive price list, but I'd be all night going through it. So I'm more than happy. Just reach out to me directly. I'll give you the pricing, and all our packages cover that 28-night guarantee. So it's going to be covering you for that, your consultations, your COVID swab. So they're very comprehensive.
Great. Okay. Professor Butler, a question for you about spinal fusion surgery. So somebody is asking on behalf of their elderly mother if they had spinal fusion surgery and needed a home care package back in Northern Ireland. How does that work? Can you give some insight into that?
Well, I suppose all patients' needs are really catered for at the initial consultation. They're also assessed by preoperative assessment, so we get a sense of how complex the patient is, how challenging the patient is, and certainly we make every attempt to provide very good, efficient care for the patients. We liaise with their general practitioners and let them keep them kind of briefed with everything that's happening, if there's any issues in their care or what their expectation is following surgery. I suppose really home care packages, Orla, you may know better than me. I would suspect they may be arranged through local services.
Yes, exactly. So obviously Professor Butler will do the procedure in that, but we do link in with the community care as well. So some patients may require that. Recently I had a patient who pre-operatively we arranged it with the local nurse liaison in community care. So we can definitely support that. And it is nice to arrange that pre-operatively. So yeah, that is something that I can assist with too with the surgeon here.
Great. Okay. We have a question about pediatric ENT surgery, Sorla. So could perhaps you explain, is there an age limit on pediatric ENT surgery? Their daughter is 4 years of age.
Yes, we can treat her. That's no problem. Majority of children that come down are for tonsillectomy, adenoidectomy, grommets. They're the main ones that we see in children. And we can offer we stick to that timeline. You're looking at a consultation within about 2 weeks. And then surgery again a couple of weeks after, and the parent can stay with the child overnight in the Mater Private. They'll have their surgery. So once a child is over the age of 2 years of age, we treat them, and we have pediatric nursing. They're very nice in the ward, and they go through everything with them. It's a lovely experience for the kids because they have I've seen on the ward, like even their scrubs are like teddy bears and they have stickers, and yeah, it's really, really nice and the setup for the pediatrics that we have.
Great. Okay. Orla, another question again. There's lots of questions for Orla tonight, so she's getting a tough gig. But Orla, how long typically does a first consultation take? Because you may have some patients who are traveling by public transport, so they're wondering, I suppose, how they make arrangements and how long they should allow for their first consultation.
Yeah, again, it depends on the specialty. Like, it can vary. I know the general surgeons have mentioned earlier on that certainly a patient might come in and have a large hernia, so then they might need to discuss open surgery where that wasn't discussed before, so that can take slightly longer. And then if you're a straightforward joint replacement, you're kind of coming in for what you know. So it does depend on what's being discussed. Professor Butler, obviously with spinal, they are very detailed. They can go on, and it's talking about everything with your procedure. So it depends on the patient, it depends on the case, it depends. And obviously with cardiology, if you're for a straightforward angio, it's quite simple. You're listed, you'll go through some past medical history, family history. Like, I would anticipate most initial consultations can range from 15 minutes, half an hour. It depends on what you need. We want our patients' questions answered, and they're leaving with a good idea on their care plan.
Okay, so it really does vary depending on their situation. We have a couple more questions in here about people who have applied for the ROI scheme and haven't heard back yet. So somebody's asking, are you aware of any delays at the moment? I think you said they're very busy right now because of the huge interest there is. But have you heard anything concrete about that, or?
They're just so busy. That's all I hear. Certainly they're just out the door at the moment, and patients do be so excited, I think, to hear, yeah, we can treat you, we'll get you in straight away, but they have to follow the correct pathway to get the approval from the board. So they're just extremely busy at the moment. And I think with that cutoff as well, people are kind of nervous and anxious to get them applications in.
Understandably so. We have another person here who has applied for the scheme, has been given a date with us, and they applied back in early March. They've had a date from Mater Private for surgery, but you've told them to hold off until they have that approval. Would that be your advice generally?
That would be my advice, yeah, because we can do it straight away, but sometimes we do need to get the approval. They won't let you claim it back without it. Unfortunately, it's not our rules, but I do appreciate they're a government body. They have to follow the rules. So, I respect that. So we can always adhere to them timelines across all the specialties we're discussing this evening. So look, it's no problem to us. We'll get you sorted once you have your approval.
Okay, I know we're coming towards the end of our meeting, but I'll just try and get one or two more questions in if I can. If somebody has a GP referral, do they have to wait for the for the consultant recommendation before they do their application? They have a GP referral.
They have a GP referral. So from our perspective, the consultants here will accept a GP referral. That's fine to attend the Mater Private. However, for the HSE&I, they will want proof that you've been boarded, that you're on the waiting list. So the GP referral won't always put you on a waiting list. So the best thing to do is try and get some communication. If the GP has referred you to, say, Craigavon or one of the Royal, wherever, contact them, the waiting list office, and get some proof where you are on that list. Even if it's a letter to prove you're on the list, that's the best thing to do.
Okay. And Orla, you can help somebody. We have a question here about what forms they should use for the referral. So you can help with all of that, can't you?
Yes, I have pre-completed forms that just filled in for all the hospital questions. I can help you with the application. That's what I do. Most of the day is help patients with that piece. So that's no problem. You can contact me for that. Okay, great.
Quickly then, do we do carpal tunnel syndrome? Sorry, carpal tunnel surgery, excuse me.
Yes, we do. We have a surgeon recently that's come on board with us, Mr. Philip Grieve, and he is a patient that performs this procedure here in Mater Private. He also, I believe he works in Belfast as well, so he knows this scheme. He treats a lot of patients through the scheme, so certainly, yeah.
Great, okay. One last question, I think, and this could be for Mr. Cashman, but indeed any of the other surgeons. If somebody has been put on the transferred out list by consultants in Northern Ireland, how does that work? Anyone know?
I'm not familiar with that, I'm afraid.
Orla, do you have any insight into that?
I'm not too sure, unless it's an internal validation process. I'd need to know a little bit more. So unless they're validating the lists and they're planning on transferring out to an alternative list, I'd have to have a bit more information. But again, just ask them to give me a call and I'll help them with that.
Okay, so that's probably the best advice.
Yeah.
I think we've got through all or most of the questions. So we might close it out there. I'll have a look later on and see if we've missed anybody. We'll get back to them. But hopefully that has answered most, if not all, of the questions that needed to be covered tonight. I'll just again, Orla is available Monday to Friday, and her contact details are on screen there. So you can contact her by phone or by email. You can also go on to the Matter Private website, which is matterprivate.ie, or indeed roischeme.ie. And you'll find a lot of information on our website that's helpful. You will see a video which gives you kind of similar information to what we've covered tonight and introduces a few other consultants. There's also a patient information booklet which you might want to download, because I know there's a lot of information shared tonight that you might want to digest a little bit later. So please do contact us. We're happy to help in any way that we possibly can, and that's Orla's job. And I hope that you'll find, you know, we look after our patients extremely well. We always take feedback. So again, if you have any concerns or you want to share your feedback with us, please don't hesitate to do that. So we're always trying to improve what we do, and hopefully we can learn from your experience as well. Before we go tonight, I would just like to say thank you to all of our consultants and to Orla for joining us. Very comprehensive meeting, and we have a lot of people online. So hopefully we've helped you and given you some advice and some guidance that's been useful. I would ask if you have 2 minutes when this meeting finishes just to complete some feedback at the end in a short survey that will follow. It's just 2 or 3 questions, but it will help us to get a sense of whether we've met your needs tonight or not. That's it from us. I'd like to say thank you again to everybody who's joined us tonight, all of our team, Orla, Dr. Hanratty, Professor Shields, Ms. McCormack, Professor Butler, and Dr. Hanratty, and Mr. Cashman. So thank you again, and stay safe and stay well, and good night from Matter Private. Take care.
Best luck, guys.